Hey everyone, Dr. Randy. Just had a new patient leave the office, and I wanted to go over, with his permission, what we found on his x-rays. Some of the x-ray findings that we saw, that we took, that helped me adjust him, give him a better first adjustment, and that will help us get him better care quicker as he comes back in our office. Guy come in with low back pain, sharp low back pain, a lot of repetitive bending, repetitive lifting, a history of low back pain. So I said, let me take a quick film to see how your low back's aligned, see how your hips are aligned, see if that correlates with the pain that you're having today. So just want to give you an idea of, one of the great things about our office is we have this digital x-ray system. So we take a film, and within seconds it's going to a computer screen, and then you and I can go over it one-on-one. I'll actually sit down and go over those with you, answer any questions you have, so we can kind of get an understanding of what maybe is the cause of your problem. And a lot of times when we look at the x-rays and we look at how your spine's aligned, the wear and tear that's been in your spine shows up on them in terms of misalignment and scar tissue buildup. And it's, a picture's worth 1,000 words. It really is. You can clearly see why you're having the problems you're having. So let me give you an example of what I mean. So, hold on one second here. Okay, so actually, if you see this guy's film here, this is a normal low back film from the side. Back up one second. Let me show you real quick. When you the spine from when you look at the low back or the neck from the side, we want to see this angle, this arc to it. The spine should have a 45-degree arc on a side view, whether it be lumbar or cervical. Cervical we see all the time misaligned because people lose that arc in their neck and they go forward. I've done a video on that. I can do another one, but that's super common because our heads are down all day and we're doing paperwork and on our phones and things like that. It can be seen in the low back. So that low back, that arc's important. It's the strongest structure in nature is a 45-degree arch. That's why they build bridges at a 45-degree arc. It can withstand the stress of the traffic. So we want to see that arc in our low back. That allows for the disc space to have to be not sort of crushed if you lose that arc. It allows good space for the nerve to come out. Just the proper positioning for your spine to be in, so things can be aligned and moving properly. So here is a normal low back from the side, and here's the gentleman's we just took. So you can see how flat that person's low back is. So here's the 5 vertebrae of their low back, right through here. 1, 2, 3, 4, 5, and here's their sacrum. See how there's no arc there, and there's a nice smooth curve here? Perfect, ideal, textbook normal x-ray from the lateral lumbar. Something that needs work. So because I was able to see that, we're able to get him some exercises, some extension exercises, and we're able to do certain adjustments that are going to help restore that arc to his low back. So that was one thing. And then we took another film on him from the front view. Go to this guy's here from the front view. Again, we'll use, this is textbook normal. So from the front, there should be no arc. The spine should be lined up perfectly, nice and straight. Each vertebrae stacked above and lined up with the one above and below it. The hips are even. There's no misalignment. There's no shifting left to right. This guy's, you can clearly see this left hip shifted up higher. So I don't know if it's going to let me do this. Yeah, it will. So I take a horizontal level. We have that for all our patients. We can kind of get a level out. We can see this left hip's higher. That dotted line is perfectly horizontal. The solid line connects the two. So there's a little bit of misalignment there. And then he's a little off center too. So I take a vertical level and go straight up. That dotted line is perfectly vertical from the middle of the sacrum. That solid line is the track that he's on. You can see that he's really shifted off to the side. So he has a pelvic unleveling and his vertebrae are off to the side. So again, that again will help me, know how to adjust him better, know what hip's out of place. So when we go into the adjustment and treatment room, I can go right to the specific problems that are going on with him. So if you're having low back pain, hip pain, I highly recommend come in the office, get checked. We can do a complimentary x-ray. It's digital, it goes right to a computer, and then I can go over those with you and take out some of the tools we have, some of the measurement tools, and so you can compare your spine to a set of normals so that you start to get these things adjusted and corrected before they become a bigger problem. I tell every tell a lot of patients, the key with this, and just like with a lot of other health things, is being preventative and proactive with your body. You can't wait till there's a major incident. You have to get ahead of things. Coming in for an adjustment, doing stretching, icing, all those things are would be beneficial, would be very proactive on your part to prevent a bigger problem down the road. So with that said, we'd love to see you in the office. Thanks. Bye.